When recovering from an injury or a medical condition, there is no better place to do so than your own home. And here to tell us what Home Rehab Express can do for you or maybe a loved one is Joanne Ellis once again with Home Rehab Express and Dr. Cliff Burmeister with Foot and Ankle Management Group. Good morning. Welcome back to both of you. This morning we have a warning and kind of a special message for any diabetics who are watching this morning. But before we get into that, Joanne, why don't you go ahead and remind people what Home Rehab Express does?
Thank you, Carly. Home Rehab Express is a home health company, and we provide in-home nursing and physical therapy, occupational therapy, home health aid services to patients that are unable to make it out to the doctor's office.
And most of the time this is covered by insurance, so it's really
100%.
a no-brainer as, again, what better place to recover than in your own home?
Right.
I know you meet a lot of doctors around the area. Dr. Burmeister is one of them. And you had a special kind of message for diabetics this morning. You say, do not neglect your feet.
Absolutely.
So this is interesting. Tell us about the connection between diabetes and foot care.
Well, in particular, diabetes, along with affecting all the organ systems, can really affect the arteries in the lower extremity. They cause them to narrow and harden, and this can cause calluses, this can cause what we call peripheral vascular disease, and it can lead to ulceration. And almost 25% of diabetics sometime in their lifetime will develop an ulceration.
Wow, those are pretty big numbers.
It really is.
Is there anything you can do to prevent it? I mean, what's your message for diabetics this morning?
In particular is strict follow-up with your internist, with your endocrinologist, as well as a foot and ankle specialist.
Like the minute you feel like something may be going on?
Well,
or...
a lot of times I always tell people look out for the 3 Ps.
Okay.
Polyuria, polydipsia, and polyphagia. What does that mean?
Yeah.
What does that mean? No, it's having the urge to urinate all the time, thirsty all the time, you're hungry, a lot of fatigue, blurred vision, tingling, numbness in the feet, something we call neuropathy. All are signs that, hey, maybe I should go get this checked out. And that's why the internist plays such an integral role. They can check your blood sugar and run other tests, something, hemoglobin A1C, to ensure that, if you are diabetic, we can treat you quickly, which is the most important.
Well, good to know if we're watching this morning, either someone is battling diabetes or they know somebody who is, to really, again, not neglect your feet.
Absolutely.
Joanne, if people want to find out more about Home Rehab Express or maybe what his office does, what would you have them do?
I would have them ask their doctor to refer them to Home Rehab Express for home health care, or they can visit our website to learn more, homerehabexpress.com.
Easy enough. Thank you both so much for being here this morning. We look forward to having you back.